Hello, my name is Jill Vu, and today we are going to explore in detail on the respiratory syncytial virus, also known as RSV for short. You have been coughing and running a fever for a week now. After a short wait in the urgent care room, the provider tells you that you have contracted RSV, respiratory syncytial virus. You now wait for checkout papers, but are left with little to no information on what RSV is. I am here to help you get a better understanding of respiratory syncytial virus is, how it works, and what treatment strategies are used for RSV. In this presentation, we'll be covering the taxonomy and classification of RSV, how RSV works, treatment strategies against RSV, and explore some of my personal experiences dealing with RSV. So, what exactly is the respiratory syncytial virus? The actual species name of human RSV is called Orthopneumovirus hominis and belongs to the kingdom Orthonavira and originates from the genus Orthopneumovirus. Viruses like RSV from the orthopneumovirus genus are single-strand RNA viruses that are encased in a lipid membrane. RSV cases are high within the pediatric and geriatric population. RSV is endemic throughout the fall season and peak during the winter season. RSV is transmitted by droplets, contaminated surfaces, or direct contact. When someone contracts RSV, the virus targets epithelial cells in the larynx and nasopharynx. From there, RSV causes symptoms such as runny nose and nasal congestion. With the help of cellular movement, RSV invades the bronchioles and alveoli. The body then recognizes RSV and starts to release level 2 cytokines, which trigger antibiotics and symptoms such as mucus buildup and inflammation in the bronchioles. RSV can lead to respiratory failure and bacterial infections that can complicate treatment. Vaccines have been established to proactively treat RSV in the United States. Currently, there are 3 vaccines approved by the FDA for adults, which are RSV, Glaxo, and Arvzivo. Additionally, Arvzivo is approved for pregnant women between 32 and 36 weeks of gestation to prevent RSV in newborns. Antiviral medication are mainly used for immune compromised patients that have contracted RSV, with antiviral therapy aimed at patients who have undergone stem cell transplant and lung transplants. Ribavirin is used in this case, which stops RSV from replicating. Additionally, it is recommended by the CDC to let RSV run its course inside the host, as the human body can clear the virus out in its own. Furthermore, symptoms such as fever and congestion is usually handled with over-the-counter medication. In February of 2016, my daughter Hannah contracted RSV. She was running a fever and lethargic, along with a severe cough. She had difficulty breathing, which made us admit her to the emergency room. Her symptoms were so bad that we needed a supplemental of oxygen. From there, she was quarantined inside a room with just me. She stayed in the room for a week until her symptoms subsided. RSV is an endemic virus that targets children and the elderly population during the fall and winter seasons, along with devastating symptoms. Hopefully, this presentation you have gained a deeper understanding of respiratory syncytial virus. Thank you for watching.